Hi, this is Steve Wasella. I'm the CEO for Children's Cancer Cause, and I'm joined today by Susan Weiner, the founder of Children's Cancer Cause. And Susan, welcome. Um, Children's Cancer Cause was founded in 1999 by you, and I was wondering if you could share sort of your perspective of what it was like then when you founded the organization, and what have been some of the most significant events that have occurred over the last 20 years.
Well, thank you, Steve, for the opportunity to talk today about what it was like at that time. In 1999, the uh, saw the first draft of the Human Genome Project, and that was really eye-opening for many of us. And around the same time, um, the there were four pediatric oncology clinical research groups sponsored by the National Cancer Institute, and they were brought together into a single entity called the Children's Oncology Group, which was the second major event. And I started the Children's Cause because I realized in that scientific environment, in that clinical environment, and indeed also in the healthcare environment, which during that time was also the time of managed care, which threatened care for kids with cancer, that there really needed to be a national voice on behalf of kids and families that would sit in national settings to really give kids with cancer and their families a voice about what their experiences and priorities were. And so that was the founding vision and intent of the Children's Cause at that time. Since then, um, I would say the major things that have happened in the past 20 years that have had an impact on research and treatment and care for kids with cancer really have derived from those two events. That is, the draft of the human genome and the formation of the Children's Oncology. The implications of the draft of the human genome really lent insights within a few years that diseases consisted of multiple subsets of disease. That is, a leukemia was no longer a single disease. Brain tumors were no longer, medulloblastoma was no longer a single disease. And that, what the Europeans call subsetting of disease, meant that there were genomic insights and about molecular pathways that made it possible to envision drugs that would target those errors and fix, in effect, cure those tumor types. So that was a major insight on, in the years following um, the draft of the genome. Um, Currently, and this to bring it up to the current day, um, there is the opportunity to have clinical genome sequencing for kids, and more so for adults now, but for kids, so that a child who presents in a clinic with a particular type of cancer can have their tumor screened and understood in molecular terms, so that a drug can be picked that could hopefully match what that aberration is. That means that that approach has made much of chemotherapy treatment obsolete, although it remains the backbone of treatment for our children, which is a whole other story about generic drugs and off-patent drugs. So those are some of the consequences, superficially, about one of the things that happened around the time of the Children's Cause founding. With respect to the Children's Oncology Group, um, what 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 happened was that there was a coordination of translational thinking and of clinical treatment of planning for clinical trials in a much vaster geographic scope, including Canada and Australia and New Zealand. So there were over 200 institutions that could coordinate their trials for a given disease or disease subset, as I said. And so there were very exciting opportunities and a lot of hard work because it was a big bureaucratic effort led by Greg Riemann initially, and then, of course, Peter Adamson, and now Doug Hawkins. So it's really only been 20 years since that's happened, and the Children's Oncology Group is the major international force that evaluates new therapies for kids with children. And I guess the third major thing that I'd like to mention today has to do with the recognition in the early years of the children's cause and in our work was the recognition of the burgeoning number of childhood cancer survivors. That is, the kids were living longer with massive doses of chemotherapy drugs, not being treated with modern drugs, which relates to the question of why and how hard it is to develop new therapies for pediatric cancers. But the survivors themselves were struggling, though living longer, were struggling with major health problems and quality of life problems. And that is a subject for another talk and something that the Children's Cause has devoted considerable thought and energy to try to improve the picture for these kids and young adults.